Today we're going to be looking at different behavioral treatment techniques for patients with dysarthria. Our first technique is called the effortful closure. So this can help the vocal folds adduct by providing an overall increase in muscle contractions in the neck and torso. This is used in flaccid dysarthria and helps people who have phonation deficits. So Morgan, what I want you to do is I want you to say a steady ah. And now I want you to hold your hands and push them really hard together while you're saying the ah. Ah. Good. All right, the second treatment technique we're going to be looking at is targeting reducing the rate of speech. This is used for flaccid dysarthria and targets resonance deficits. So Morgan, what I want you to do is I'm going to be tapping my hand just like that. And I want you to say a word per tap, okay? So I'll give you an example. My name is Katie. You go.
My name is Morgan.
Good. All right, so the next task is called the yawn sigh, and this targets phonation deficits in patients with spastic dysarthria. So this helps with relaxing the head and neck to reduce hypertension in the larynx. So what I want you to do is take an inhale, and when you exhale, yawn and do an ah. So I'll give you an example. Good. All right, so another technique used is pitch range exercises. These are used when treating a patient who has prosody deficits in ataxic dysarthria. So for this, we are going to start with a lower pitch, and we're slowly going to increase it to a higher pitch. So it's going to sound like this. There you go. Good. All right, our last behavioral treatment technique is exaggerating our consonants, and this is also known as over-articulation. So this is an exercise used with clients who have articulation deficits in hyperkinetic dysarthria. We're going to be concentrating especially on the medial and final consonants of words. So Morgan, what I want you to do is exaggerate your consonants and pronounce them very clearly. So for an example, my name is Katie.
My name is Morgan.
Good.
Okay, so today we're going to be doing some behavioral treatment techniques for different types of dysarthria. So the first technique is correct posture technique, which is used for respiratory weakness that affects phonation and prosody. And it's good for individuals with flaccid dysarthria. So when we start our session, I would just tell Katie, can you sit up while we speak? And if the client isn't able to sit up on their own, then you can use prosthetic devices to aid them. So our next technique is easy onset phonation, which is used to improve phonation deficits by teaching the client to make softer glottal closures. So the first step in this, and it's also used for spastic dysarthria. So the first step in this is to exhale while sighing. So, and once they're able to do that consistently, you're going to move on and have the client exhale while saying ah. So, good. And then once they're able to do that consistently, you're going to shape that into a word that starts with a vowel usually. So, for example, apple. Apple. Good. Okay, so our next technique is the finger or hand tapping technique, and it's used to improve prosodic deficits by slowing the rate of speech, and it's used in ataxic dysarthria. So I'm just going to tap, and I want you to say a word per tap. So for example, my name is Morgan. Okay, you go ahead.
My name is Katie.
Good. So the next technique is the pushing and pulling procedure, which is also called effortful closure. And it's used to improve phonation by helping overcome reduced range of motion in laryngeal muscles for hypokinetic dysarthria. So what we're going to do is I'm just going to have you say, ah. Good. Now I want you to do that same thing, but I want you pushing your hands together while you do it. So, ah. Good. Okay, and our final technique is just for increasing loudness, and it's used to mask hypernasality quality in individuals with spastic dysarthria. So instead of saying, my name is Morgan, I would like you to say, my name is Morgan. So you are masking that hypernasality quality. So go ahead.
My name is Katie.
Good.